Monday Health Minutes, sponsored by Valley Health.
Hi, I'm Melanie Schaefer. This is Valley Health Minutes. Today, we are talking about Medicaid and specifically Medicaid unwinding. Hundreds of thousands of people get their health care through Medicaid, and the unwinding process is underway. What exactly is that, and what do you need to do to ensure that you have health care coverage? We're talking with Valley Health's Brandy Andrus today about that. She's the lead assister for Valley Health and helps with all kinds of health care applications. This is a big topic. Explain to me, what exactly is Medicaid unwinding and how did we get here?
The Medicaid unwinding is the end of the continuous enrollment phase that was put in place by the government, by Congress. It's ending, and so we'll begin the re-enrollment process. Anybody with Medicaid can reapply, re-enroll. They can also get private insurance if they do not qualify for Medicaid after this is ending.
So during the pandemic, Medicaid just kind of had that continuous enrollment.
Right.
No one had to be reevaluated, but now the reevaluation period begins.
Yes.
That means people could lose their coverage. What do they need to do to make sure they're making their deadlines?
They need to report to the DHHR their good mailing address, their phone number, their email will help. Any way that they can be reached with a letter, a phone call, or in their email, whatever they prefer. That's going to be the best thing they can do, is to make sure we have their current information as well as the DHHR.
When did unwinding is underway? It started at the very first day of April of 2023. Is there an end date, or is there a deadline that people have to make?
They have from April the 1st of 2023 until July of 2024 to make any changes. So their coverage may end at the end of a month. They do have a grace period until next July. We don't want them to wait that long to get coverage. We want them to turn around and have that turnaround time be quick, so they can keep their coverage, hopefully, or look for other options.
It can be overwhelming. People have gotten used to having that continuous coverage.
Right.
What would cause someone to maybe not qualify now that they're being reevaluated?
Income would be a big one, because income was not looked at. Household size with the income is going to make a difference for a lot of people, and they're going to come off of that and need private health care or a job-based health coverage.
So after people have established that their state DHHR has their right contact information, their address, their phone number, their email, how can they get help to kind of process this?
They can actually come to Valley Health if they want to get more information. I actually schedule people for an appointment if they'd like to come in and get more information, so we can do it that way. If they have a caseworker that they already established work with at their local DHHR, they can contact that person. They maybe feel comfortable doing that. They can actually walk into the DHHR and ask for a representative to help walk them through that process. So there are a few different options.
And Valley Health is offering some community days also. If you can't get to one of those spots, you can actually sit down with someone in a private space and talk about what your options are.
Yes, we're doing outreach events this month and next month, and so we will post those on our website, valleyhealth.org. So please do check that out. It will be a great way to sort of feel more comfortable in the process if you come to one of our events, because we will be kind of having some free things to give away, some information. You can ask questions, and then if you want to talk with somebody privately, there will be an area to do that.
Should people be, it's stressful to think that Medicaid could be ending, but there are other health insurance options out there that
Right.
Valley Health representatives can guide them to.
Yes, healthcare.gov. A lot of people know that as Obamacare. It is the health insurance marketplace, and that is what I personally assist in, and then we have trained staff that can also do that. And there are plans available, very low cost, because this transition is concerning, so people want to feel comfortable in getting something new, but also feeling like they can attain that and afford that.
And Medicaid recipients need to make sure they act on this now and not wait.
Right, yes. Please update your mailing address, phone number, email. Please, if you do get a letter, a renewal letter, a review packet, please open that, check it, renew it, and please send it back.
All right. The time is now
Yes.
to act for this Medicaid unwinding. All right. And it's nice to know that there are people out there that can help you through the process. That's very reassuring for a lot of folks. Brandy, thank you so much. We appreciate your time.
Thank you.
Thanks for being here for Valley Health Minutes. We'll see you next Monday.